Nowadays, it is difficult to say the MCQ has been from which subject. Is it from pharma? Is it from medicine? Is it from obs gynae? Is it from micro? I mean, an MCQ, if they formulate nowadays, you need to have knowledge of all the pre and paraclinical subject and correlate them to the clinical subjects. So let us say, suppose they will ask earlier, the MCQ used to be like, what is the drug of choice for cryptococcal meningitis? So it's a plain simple MCQ of pharma, cryptococcal meningitis, what is the drug of choice, right? So nowadays, the same MCQ will be asked in a different way. First, they'll give you presentation. A patient presents to the emergency with severe headache, nuchal rigidity, and all of these will point towards Kernick signs is positive. This will point towards the patient being suffering from meningitis. Then a CSF culture was done, and in the CSF culture, CSF was positive for cryptococci, or they will give you was positive for capsular polysaccharide antigen. They have to make a diagnosis from micro plus medicine that it is a case of cryptococcal meningitis, and then what is the next best step? And then you have to answer it as amphotericin B. So it is actually we're reaching the same point, but the job has become much more tedious now because it is much more clinical. So I just joke in my offline classes that nowadays those 200 MCQs will feel like you are not solving 200 MCQs, rather you are treating 200 patients in an OPD or a ward. So that is the scenario which has become, and the MCQs, they have become much more practical. Though 10 to 20% of MCQs we still get, which are direct ones, which are based on rote learning, but we have to change our way. A lot of students are nowadays doing that. They study system-wise, right? In fact, this is something which I used to do as a student and advise to each and every student. You have to do this not only for pharma, but three subjects which are very volatile from the preclinical aspect: pharma, micro, and biochemistry. It's called as RRR formula: read, revise, re-revise. Right. So how does it work? Let us suppose I study something for 2 hours today. Tomorrow, towards the end of the day, I will revise whatever I've studied today for 20 minutes. I'll revise. The next day, I'll read something new. Then I'll revise 20 minutes, whatever I've studied yesterday. 10 minutes, I'll overlook briefly, quickly, whatever I've studied day before yesterday. So 2 hours, 20 minutes, 10 minutes. Read, revise, re-revise. So essentially what you're doing is you're not only reading and revising, you're revising and re-revising. So 3 times I'm revising and simultaneously. And what this does is you will see at the end of the day, when after 25 days, after giving 2.5 hours every day, you will see there is a virtual image of your notes is going to be created in your brain. And actually, if you close your eyes, you can flip through the pages in your mind. Now, to reach that stage, you need time, and gradually you have to cover it up. One of the most important part of pharma as such is the new drugs which they ask. But again, let me give a disclaimer here that the new drugs are important only for INI-CET. They're not important for NEET PG. They do not ask much about the new drugs. So if you're specifically preparing for the INI-CET exam, I mean, you guys must be following me or any other teacher on Instagram, pharmacology teacher. So all of us, we do put updates on the new drugs. So what you need to do is just, add those new drugs to the respective section. For example, let me tell you about a new drug I have posted on Instagram, and the drug is called as atripamil. So atripamil is a non-DHP calcium channel blocker which blocks AV node, and it is given by intranasal route for treatment of an acute attack of PSVT, right? Intranasal for self-treatment. So whatever resource you're following, you can just go into your notes and to the calcium channel blockers in antiarrhythmic drugs where we use only diltiazem and verapamil. You add another drug, atripamil, right? So by doing this, what will happen is you'll automatically update your notes so that you don't have to read separately the new drugs. You'll read them in context of how they fit in with respect to the already existing drugs in that particular topic.